My name is Mai Gadalla. I'm the data manager at the ERF and also associate professor at Cairo University. Right now, I'm gonna give the floor to Yasmin Fahim. She's gonna tell you some of the instructions. Okay.
Thank you, Mai. Hello, everyone. I'm Yasmin Fahim, the Director of Research Programs at ERF. It's lovely to see you all and welcome to our very first special panel in the context of the ERF 27th Annual Conference. The panel is on the impact of COVID-19 on the Middle East and North African labor markets. And I'm particularly pleased because the project on which the session is based is very close to my heart and is a testimony to how responsive and relevant ERF is when it comes to addressing emerging issues and trying to fill knowledge and data gaps. And before I let you enjoy the panel, we have 3 organizational points that we'd like to make. The first is related to translation. So we are providing English and Arabic translation. At the bottom of the screen, there's the tiny globe. If you press on it, it gives you the option of the English channel for the English translation. And if you want to follow Arabic translation, you need to select the Spanish channel because Zoom does not allow the term Arabic yet. So if you want Arabic, please follow the Spanish channel. And if you just tune in as is, you will follow the live proceedings. Now, the second point is with regards to questions and comments from the floor. So at any point, you can click the Q&A button. So you can post questions addressed to our distinguished panelists, and they can take up your questions directly or table them for discussion at the end of the panel if they wish. Also, at the end of the presentations, the chair will open the floor for taking live questions. And if you have any intervention, we kindly ask you to press the raise hand button, and the chair will be able to give you the floor. Finally, the sessions will be shared on YouTube live, and it can be accessed anytime immediately after the session. So feel free to check all the conference sessions on YouTube and share with your friends. And with that, I'm done. And I hope you'll enjoy the session, and I'll give the floor back to Dr. Mai. So Mai, over to you.
Hi, everyone. Again, I'm gonna share my screen. Actually, I'm very honored to be here with you today, and I'm very honored to have the opportunity to introduce to you one of the big projects that was led by the ERF during the past year and during this year as well. I'm going to introduce to you the COVID-19 MENA Monitor Survey. It provides actually data for researchers and policymakers on the socioeconomic and labor market impact of the global COVID-19 pandemic on households and firms. The richness of this data or this survey comes from the fact that it is a panel survey covering several countries in the MENA region, and this is the first time to cover this number of countries and do a panel survey as well at the same time. And it has 2 components. It has the component of the household surveys and the firm surveys. It's using series of short panel phone surveys, and it's conducted every 2 months. It covers Egypt, Morocco, Tunisia, Jordan, as well as Sudan, which is actually the first time to have data on Sudan. That will be actually published at the data portal later, inshallah, when it's ready. And it's the first time to have data on Sudan and the MENA region as well. As I mentioned before, it has 2 components, the household survey and the firms survey. This richness of the data actually allow the researchers to have or to conduct comparative studies, whether it's going to be comparing between these countries or over the time through the previous years and the current one. In addition, from a statistician point of view, actually, this is very interesting research. And in some of the examples that we can compare results of face-to-face surveys with the phone surveys. This is one point. Another point, we can study more in-depth the attrition component through the time, since we have several waves of this data. Actually, this data was made possible by the generous funding of these organizations, the ILO, the International Labour Organization, ALBA Project, and Cairo office and Ethiopia office, the ERF Fund for Economic and Social Development, the World Bank, and actually the World Bank is allowing us to have the opportunity to publish this on the data portal as well, the Swedish International Development Cooperation Agency, and the Foreign Commonwealth Development Offices. And I have to say, actually, that there were great efforts done by the ERF team and by the principal investigators, Dr. Rogi, Dr. Carolyn, and Dr. Marwani, and by our program officer, Iman Al-Hadari. So this is a good opportunity to thank her as well. Okay, since I am responsible for the ERF data portal and the data, I am the data manager. I'm taking the opportunity to introduce to you the ERF data portal. I'm gonna talk about it only a few minutes. So all the data sets that have been released till now, we have released wave 1 and wave 2 from the household, and very soon we're gonna publish wave 1 for the firms on the data portal. We have it for each country, and we have a combined data set. So these data sets are currently available on the data portal. As you see here, this is the link to the data portal. And if you type down the Google ERF data portal, you'll get access to this data. All the researchers are welcome, actually, to request these data. They should follow some of the steps, and it's easy steps, and will provide them access to these data sets for their research. In addition, actually, to the COVID-19 MENA monitor, I must say that we have more than 100 data sets available for different countries in the MENA region. These data sets cover the household income expenditure surveys, cover the labor force surveys, in addition to the labor market panel surveys that were conducted in Tunisia, Egypt, and Jordan. So this is the link to our data, our data portal. So please, if you need any data sets, you can request it, okay? And thank you. Right now we have 3 speakers, Dr. Rogi Asad, Dr. Marwani, and Dr. Carolyn. They are the PIs of the COVID-19 MENA monitor survey. Dr. Rogi Asad is a professor of planning and public affairs at the University of Minnesota Humphrey School of Public Affairs. He is a research fellow of the Economic Research Forum in Cairo, Egypt, and serves as a member of its board of trustees. In addition, he is also a member of the board of trustees of the Arab Council for the Social Science in Beirut, and a research fellow of the Institute of Labor Economics in Bonn. His current research focuses on labor markets, as you all know, human development in the Arab world, with focus on youth, gender issues, education, transition from school to work, employment, unemployment, informality, migration. In addition, recently, he has been researching the effects of the Syrian refugee on the Jordanian society and issues relating to the welfare and adolescents. Our second speaker, Dr. Marwani, is the representative of the Institute of Research for Development in Tunisia and associate professor in economics at Paris Sorbonne University. He's a research fellow of the Economic Research Forum as well, member of the advisory group of the African Evidence Network, and research fellow of the Migration Institute. His research focused on the interaction between structural change, skills demand, and productivity growth, and on the impact of migration in the MENA region. I'm sorry.
Dr. May, if you can stop sharing screen, please.
Dr. Caroline, yeah. Oh, yeah, sure. Actually, Dr. Agi, you can start sharing the screen. I need to introduce Dr. Carolyn Kraft as well. She is an associate professor of economics at St. Catherine University. She received her master's degree in the public policy from the University of Minnesota's Humphrey School of Public Affairs, and her PhD from the Department of Applied Economics at the University of Minnesota. Her research examines issues in development economics, primarily labor, education, health, and inequality in the Middle East and North Africa. And her current work includes work on refugees, labor market dynamics. Right now, we're gonna give the floor to the speakers. Each one will have around from 10 to 15 minutes to present. And afterward, we're gonna have actually 2 rounds. We're gonna have time, so we'll be able to have 2 rounds of the Q&As. Okay, Dr. Raghi, please.
Thank you very much, Dr. May. It's really a pleasure to join you today. I'm joined for market survey, so I'm very excited that we're getting to that point after many years of preparation. As you can see, it is an enormous undertaking. It's 5 countries, up to 5 waves, households and firms. So it's a huge undertaking logistically. It's a huge undertaking in terms of data management, in terms of funding, communications, and there's a huge team behind it that I think we need to acknowledge. So although May did mention some of the team, let me mention it again. Huge role in launching the project from the beginning to the end. Dr. May, of course, May Gadalla has Muhammad have all played a huge multiple deliverables, many donors to satisfy with reports. Passant Atif has also worked on the admin and contracting side of it. Hussam Ibrahim has worked on the analysis. And then Carolyn Kraft, besides being a PI, has really done a lot of the heavy lifting of the data management and data preparation so that you can get the clean, nice data sets that you all are going to be able to enjoy as researchers and analysts. So I just wanted to acknowledge the enormous amount of work that has gone to create this public good, which is going to serve us for many, many years to analyze what happened in this really watershed year in the history of our region. So we're going to divide our presentation into 3 parts. I'm going to talk about the closure policies and the impact on aggregate labor market outcomes. Dr. Marwani is going to talk about the more specific economic policies targeting firms and workers and the impact on firms, workers, and particularly small enterprise and family enterprise. And Dr. Kraft is going to talk about the social policies and social support policies and the reach of these policies and who may manage to benefit and who didn't from the policies. So let me kind of start by saying that this is a presentation about essentially Egypt, Jordan, Tunisia, and Morocco from the first 2 rounds of the COVID MENA Monitor Survey. And just looking at these 4 countries, we can see that the countries were very differentially affected by the pandemic, the different timing of when the pandemic hits, and the different levels of the pandemic. And they pursued very different policy responses and followed varying economic trajectories. And so by looking at 4 countries, we can really contrast these various trajectories. And so the first wave, even though Egypt, to some extent, was part of the first wave, it was a different survey, different instrument, so the data is not completely comparable. We're able to compare mostly Morocco and Tunisia from the first wave, which was carried out around November 2020, and in the second wave that was carried out around February 2021, we are able to do all 4 countries. And so you might see that we're able to compare Egypt, Morocco and Tunisia, what happens in November and what happens in February, whereas in Egypt and Jordan, we're essentially looking at what the situation is in February, and in some cases we're able to compare to pre-crisis situation. Now, none of the 4 economies have recovered to pre-pandemic levels yet, neither in the levels of employment or levels of income. But we do notice from having these multiple surveys, multiple waves for 2 countries, that there's been an improvement in the situation between November and February in the 2 countries which we have 2 waves in most variables. They're not all variables, and although the improvement is relatively modest, we do see a trajectory moving in the right direction. So let me just discuss how the various countries have experienced the pandemic. As you can see that in terms of cases and deaths, the March-April period, there's a very, very low number of cases in all countries. Egypt has had a slightly earlier severity of the pandemic. You can see that slightly in the May-June number of deaths. Egypt kind of showed up a little bit, and in the number of cases as well. It also, if you go to the July-September quarter, you see that it's Egypt and Morocco that have the biggest death loads. And Jordan and Tunisia really were doing very, very well during that early period of the pandemic, which, and it's only in the last quarter of 2020 where the pandemic really explodes in Jordan and Tunisia. And you can see that the number of deaths per million goes way up in Jordan and Tunisia, and to some extent dwarfs what it is in the case of Egypt and to some extent Morocco. And it gets worse as you get into the first quarter of 2021. So Tunisia and Jordan both have kind of weathered the early phases of the pandemic quite well, but then got it back with a vengeance. And we're going to try to link that to some extent to the policy responses of the 4 countries. And so if you look at this, this is a stringency index, which is compiled by the University of Oxford to look at government responses, the public health responses to the pandemic, the closure policies that they have followed. 100 is the maximum closures, and 0 is no response. And so you can see here that in the early phases, Egypt had a modest response, 73, which is relatively modest compared to the other countries. Jordan had a very extreme response, 94, close to 100. And if you look at a lot of part of that period, they were at 100. Took all the measures at the most extreme level. And then Morocco and Tunisia were very high stringency as well in the early period. But neither Jordan nor Tunisia were able to sustain that. And you can see them both dropping quite substantially by the May-June period in terms of their stringency, and in Tunisia even more so in September. So Tunisia goes one of the most stringent regimes in the early period to one of the most lax regimes in the world by July and September. whereas Egypt kept pretty much at that moderate level of stringency throughout, and to some extent Morocco as well. So what are these measures? These measures include school closing at all levels, whether from primary all the way to higher education, closing of some or all but essential workplaces, canceling of public events, restrictions on gathering. Sometimes they have certain size gatherings above a certain threshold. Sometimes it's all gatherings that are restricted. Requiring or recommending closing of public transport, stay-at-home orders with some minimal exceptions, and then internal movement restrictions within the country and border closings of the country. So these are the measures that are being followed by the Stringency Index, and you can see that two of the countries had fairly consistent measures, and they did better in the latter parts of the pandemic, and two of the countries had very strict measures at first and rather lax measures after that, having to then come back strict measures after the pandemic really blew up. Now, if you look at the effects on the economies of these countries, to some extent that reflected, so we have here annual growth rates in 2019 pre-pandemic, what the growth rate in all of 2020 are. You can see that Egypt is the only country that managed to eke out a positive growth rate in 2020 because it had relatively moderate closure measures and the economy did not shut down completely. It also was the country that had the highest growth rates prior to the pandemic. Jordan was already struggling prior to the pandemic and contracted by 1.8% per year during 2020. But in the case of Morocco and Tunisia, the contractions were much more severe at 7% per year and 8.8% during 2020. So you can see that big effects. Now, vaccination rates have also been very different across the four countries. Egypt has had by far the highest vaccination rate as of the end of March of 2021. And Morocco has had by far the highest vaccination rates, but you can see that it's really quite all over the map. So now let's look at what the impact on the labor market aggregates. While we would have loved to have the pre-pandemic values of these labor force participations and employment rates, but because this is a sample of mobile phone users, the data is not strictly comparable to the overall population data that's produced by the regular household labor force surveys. So that we didn't really have an actual measure that is comparable of the labor force participation and employment rate for this particular population of mobile phone users. And so we refrained from putting a pre-pandemic value. But you can see that participation rates tend to be quite high in Egypt, Tunisia, and Morocco for males, and much lower in Jordan in February 2021, if you compare across countries. But the other thing to note is that participation rates in February in Morocco and Tunisia are higher than what they were in November. So there is, if there is a negative impact on participation among males, it recovered a bit between November and February. Employment rates also recovered quite substantially, and they were quite low in the case of Morocco and in Jordan as well. Now, with women, we are much more concerned with on participation, and you see that participation rates here appear relatively high compared, if people know these countries, the numbers you would normally see are lower than this. But the reason they are relatively high is because of mobile phone users, and they tend to be somewhat more educated and therefore have somewhat higher participation rates than the population at large. But also here you can see significant recovery in participation between November and February for the two countries for which we have these two data points. And that also involves a recovery in employment, except that in Tunisia, the recovery, in fact, there is a slight decline in participation in Tunisia and a very small increase in the employment rate. So, there is still a concern that both employment and participation are depressed in Tunisia. Now, unemployment rate, take among those who participate, the portion who are not working and wanting to work and ready for work. And we use this broad definition of unemployment, which does not require search for employment, because a lot of people were discouraged from searching during the pandemic. But we also have the standard definition, which includes search, and that is the one with a somewhat lighter color. And you can see again that unemployment rates are known to be high in this region. And so they're fairly high and much higher for women than they are for men. But you can see that there is a slight decline in unemployment rates in Morocco and Tunisia, whether you take them in the broad measure or the standard measure, but not a very big decline. I mean, it's really there's a bigger decline in the broad measure than in the standard measure. So that the economies are maybe recovering, but still struggling quite a bit in terms of coming back to the pre-pandemic level.
Okay, I think the internet is not stable over there. So let's wait 1 minute and maybe it will come back.
Dr. Raghi is back.
Okay.
You have to unmute.
I'm sorry, here I am, I'm back. Can you tell me at what point I lost you? Or you lost me?
You were in the midst of the unemployment rate.
Okay, so in any case, I just want to make the point that there is a small recovery in the unemployment rates. Now I want to go to my last graph, which is the comparison between the employment status in February 2020 pre-pandemic and what happened to people who were employed or unemployed or out of the labor force when we observed them either in February or in November or in February 2021. And the key takeaway from here is that a lot of employed people in February 2020, by February 2021, were not employed anymore. And you can see
Raghi,
that
you're not sharing your screen, sorry.
Dr. Raghi, will you please share the screen again?
Yes. Okay, I'm sorry about that. This is.
You can turn off the video if it's gonna increase the quality of the net.
All right, let me turn off the video. Sorry about that. This is the problem of being in a country where the internet is rather patchy. So it says my connection is unstable. Let me see if I can finish in the next couple of minutes. So clearly here, a lot of employed people in February 2020 lost their jobs, about 20% in the case of Jordan, more so in the case of Morocco, and somewhat lower in Tunisia and Egypt. But the key issue is that they're not only losing their jobs to be unemployed, but many of them are losing their jobs or are leaving their jobs to be out of the labor force. So a lot of these are the women who have been forced out of the labor force because of care responsibilities, which I hope Carolyn is going to talk a little bit more about. But the good news here is that among those who were employed in 2020, if you look at Morocco and Tunisia, fewer of them are non-employed or are either unemployed or out of the labor force in February 2021 than they are in November 2020. So that they seem to be somewhat coming back to some extent to employment in February compared to November. and there is a slight recovery. You can see both in Tunisia and in Morocco. Now, the unemployed in 2020, these are people who are generally looking for their first job in these countries. You find that many of them are still unemployed, right? So what's not shown here are those who are still unemployed. But among those who are not unemployed anymore, in fact, a bigger proportion left the labor force, got discouraged and left the labor force. They no longer want to work compared to those who actually got jobs. So there is a sense of probably a great amount of discouragement, and that there's no point in searching or looking for work. And then you can see that, however, that still there's a slight improvement. There are fewer people who are still unemployed in February 21 than in November 2020. That's the case in Morocco, but not the case in Tunisia. In Tunisia, in fact, there are more people who are still unemployed in February 2021 compared to November. So the picture is a bit more mixed in Tunisia in terms of recovery. So let me just conclude here. So in Egypt, which had the least stringent policy response and maintained it for the longest time, and reduced measures very, very gradually, they had a more moderate effect on the economy and maintained positive rates of economic growth, and their employment response was not very, very large. In Jordan, which had started very, very stringent, could not maintain it, initially was spared the brunt of the pandemic, which came to hit it with a vengeance in late 2020 and early 2021, and probably the effects will linger throughout 2021, if not the 2022 as well. Whereas Morocco, like Egypt, maintained relatively moderate closure policies for longer. They had a large negative effect on growth, but the labor market aggregates are recovering in Morocco in early 2021. Tunisia is more like Jordan, where they had fluctuating response to the pandemic. They failed to contain the pandemic in its later stages, very large negative effects on the economy, and very much slower recovery in labor market aggregates, if any. And we will hear more from Mohamed Ali Marwani about this. So thank you very much, and I'm sorry about the technical problems here.
Thank you, Dr. Raghi, for your valuable speech and talk, and for the valuable information and the rich information that you presented. And now I will give the floor to Dr. Marwani. Please, will you please share your screen? Okay, thank you.
Sally, I think you're still on mute.
So thank you very much, Dr. May and Dr. Raghi, and thanks for the participants. So I see in the participant lots of friends from the ERF family, so people that we used to see every year in the ERF conference. And so happy to see them again here, although not directly. As Yasmin said earlier, also, I'm very happy that this project is really today here with results, and because we started in March 2020, so at the middle of the confinement, talking about it. And so now it's been 14 months. We've been spending a lot of time there, and very exciting experience, very nice team, everyone very devoted. So it's really shows the strength of ERF in such kind of moment. Now coming back to the results, so I will not detail everything because you'll have the policy brief in a few days or maybe in 1 or 2 weeks, but I will try to tell what kind of lessons we learned from this exercise. And probably this exercise was meant for 2 purposes, one short term and one more long term. So the short-term objective for us was to inform policymakers, analysts, decision makers, everyone about the evolution of the situation. So to take decisions, we need to know information. And what was happening is that only the World Bank at the beginning was doing this exercise. So the World Bank did similar surveys, but they ended probably in October. So our survey started almost just after the World Bank ones. And now we are almost the only source of information on COVID, impact of socioeconomic of COVID in the region. So this is really a huge achievement for ERF, of course. So the second objective is to do research, and research on the long run, and then it's not just COVID, but it's research on shocks, research on understanding the weaknesses that we may have had before. For example, Raghi was explaining that there are some problems in Tunisia, but Tunisia in 2019, and we've seen this in another work we've been doing also, had already weaknesses. Growth was almost zero in 2019. So a country starting the crisis with almost 1% growth does not have the same economic and fiscal space like a country starting with 5 or 6%. So we want also to understand the structural problems of the region. And COVID may help understand many of these, like the problems of digital or technology, the problems of any types of rigidities, any structural problems of the region. So I'll start by saying a few words about the support to the economy. So this had, you'll see in the brief that we have a very detailed table about this. We have different kinds of support that was stronger in some countries, less strong in others. The first response was from the central bank, so decreasing policy rates, very high in Egypt by 3%, 1% in Tunisia, so more prudent, the central bank of Tunisia, and then various others in Jordan, Morocco. Then there are also different prudential rules that were softened to allow monetary financing or to allow more debt. The government allowed, for example, the central bank to lend money to the government in Tunisia, which wasn't possible since 2016. In Morocco also there was different possibilities introduced to give more room to the economic management. And in some countries there were even the creation of special funds, like Himat Watan in Jordan, Daman in Morocco. In others, we didn't have these special funds, but most of the policies were in the spirit of tax credits, in some cases, subsidies, especially wage subsidies to allow companies to continue paying wages. Mainly on some sectors like tourism and transport, the sectors that suffer the most, and in some cases focused also on SMEs, because these SMEs, of course, suffered the most. The problem, as I said, for these countries, we see that the amounts spent are different because these countries have different fiscal space. So fiscal space in Tunisia, for example, was very low. And as Raghi showed earlier, the loss was very high by 8% for GDP. So this gives you even less fiscal space because you have to, of course, you don't have taxes. When you don't have growth, you don't have taxes. So you have less means to finance all these measures. And given that the very high stringency applying during confinement in countries like Tunisia or Jordan, the first confinement, this creates even more problem for the other periods. And probably in some countries, people may have thought that it's just a one-shot issue and they managed it this way and maybe not necessarily thinking about the second and the third wave, etc. So maybe they spent most of the money for the first wave. Maybe also the other issue is that in some countries, there were more political issues. For example, in Tunisia, there were lots of government changes for Ministry of Health. So it's more complicated than in country where there are, of course, more stability. So there was this business support, but there was also supports for workers. So workers, of course, are not all threatened the same way. We've done a study on this to try to see what are the main threats. And the threats are for workers that cannot work from home, that are not public workers or working for big firms that have formal contracts, and workers in regions where there were no essential industries. So we show a map with the most threatened workers. And this map was not necessarily used by the policymakers, of course, who did the subsidies. So when they decided the subsidies in general, they tried to minimize layoffs and so encourage firms to pay wages. And in some cases, government paid fully or part of the wages when firms were committed not to lay off people. The problem, however, in our region, as you all know, is the informal sector. So we have many issues with the informal sector. First, to identify informal firms, because they are informal, we almost don't know them. And the other problem is eligibility, because when the different procedures were put in place, they were put for firms that were eligible because they were paying social security, etc. And so these firms found themselves unprotected, and so the workers working, so informal workers who are sometimes can be in informal firms, but when we have informal workers in informal firms, we have a double burden because they don't have social security and their firms are not protected. And so you see in some cases that, and we'll see later the outcomes that for these, of course, domestic enterprises and also for workers working outside establishments, the outcomes are the worst. Maybe the only advantage probably for some informal firms in this period is that maybe they're less constrained by social distancing, but this has to be checked. It's just a hypothesis that maybe they can respect less. For example, you see on markets, people who sell products on the streets, they don't really respect the regulation. So some people saw in this crisis the opportunity to formalize, and there are often these kind of opportunities in crisis. But of course, we have to take care about this idea because it may be true for some type of firms. So we've shown this for Egypt on a paper with a colleague, Ms. Maali, that some types of firms can, when there are incentives, formalize, but some others, for other reasons, are very far from being able to formalize. And so this has to be taken into account when thinking about these opportunities. So now I move to the outcomes. So here you can see that for the different countries, you can see that Tunisia and Jordan, but also for some parts, Egypt have been had the highest rates of layoffs, particularly for the informal sector, informal private, and especially for those who are out of establishment. So we see it's the almost red-black one. You see that in Morocco, we have much less impact on layoffs. And however, lots of workers are not wage workers anymore. And here, when we look at farmers' experience, we see that there has been also a big loss for farmers in the three countries, Morocco, Tunisia, and Egypt. And this is important to notice because many people consider that the COVID crisis is an urban crisis, that farmers were not really affected, which is totally wrong. So not only they were affected by a drought in Tunisia and Morocco, so this is not COVID, but also they had a lot of problems due to COVID. For example, they couldn't buy the seeds. So this was very complicated to buy seeds, fertilizers, inputs, etc. As we can see here when you look at that line of seeds and inputs. But also their markets, of course, were disturbed. In confinement, many markets were closed. But also the demand has been reduced a lot. For example, in a country like Tunisia, where there are 7-8 million of tourists entering every year, if these tourists disappear, you can imagine that there is much less food bought. And so the demand for these products decreased a lot. And it's the case for the other countries as well. And you have also the decrease of income, which decreases the demand also for food products, of course, especially for the poor people. And we've seen and Carolyn will probably talk about it more later. The next table is about the operational status of domestic enterprises and self-employed. And you see here that Tunisia, Morocco, and Egypt have the worst rate in terms of closure. So the results have been improving slightly for Morocco. I mean, improving a lot for Morocco. For Tunisia, we don't have any improvement between November and February. And here it's interesting to look because what happens is that a country, when they open a certain period, probably the effects of the pandemic are very important, the period just after, and so they have to close even more. So probably this is what happened when you compare Tunisia and Morocco. Tunisia had a lower stringency index, and then it had to add a higher stringency index than Morocco. And finally, here we see the revenue changes. And for the revenue changes, you see also here that for Morocco, the situation has improved, while for Tunisia, we don't have this improvement between November and February. So what are the takeaways? The informal workers in the 4 countries are really the most affected. And in Tunisia also, and Egypt, formal private workers as well. Those outside establishments in particular have the worst outcomes. The nature of work has been the major constraint for working from home, and not technology, not the problem of having internet. Or it's mainly the nature of work, because their work cannot be done from distance. Farmers were affected and often neglected in the policy response. And the situation of household businesses is very critical, although it deteriorated in Tunisia but improved in Morocco in the recent month. And to conclude, the next steps will be to try to deepen this analysis, this first analysis, to try to identify the factors of vulnerability, understand the coping strategy of actors, and assess the effectiveness of public policy. Was it well targeted or not? Was it enough or not? And try to have lessons for other shocks. I think this is also important, because we don't know what will happen in the future, and it's important to start thinking about how we could manage this type of events. And finally, maybe the next point is about social protection, and this is a transition, because all what I said, if we have good social protection, maybe it can be, the effects could be lower on the people. People, if they lose their job, then there is social protection. Of course, it's much less a problem than if there is no social protection. So it's the time to have the transition with Carolyn. Thank you.
Thank you, Dr. Marwani, for your presentation and for your effort. Actually, it's a great effort from the 3 PIs. Right now, actually, the floor is to Dr. Carolyn. Please share.
Fabulous. I'll share my screen here. I'm very excited to be discussing with you all today the results of this important data public good. And since folks have already been talking about the roles of the excellent management teams, as well as the ERF data team and the funders, I'll take a moment while I get my screen set up here to talk about the importance of our respondents and the importance of having the data collection firm and the respondents really play a very key role in these efforts. So I really appreciate all the folks who answered these questions. Okay, I think you should now be seeing my screen and the slides. So I'm going to be talking particularly about the labor market and social protection here, and also some social services aspects. So the fundamental question I'm asking, and building off of what Dali and Raki already discussed, is how did countries' social protection systems respond to COVID-19 and the ensuing economic and social challenges? So we talked already a bit about what was going on in terms of the public health response, in terms of what was happening with employment and unemployment, but how did the social protection systems kick in and respond to these challenges? And using the same COVID-19 MENA monitor household data, primarily wave 2 data, I'm going to talk about receipt of forms of social assistance and how this depended on income pre-pandemic and labor market status. So basically, who's getting social assistance and cash assistance during the pandemic. And then what happens to income, right? We'll see from what Ali said, we saw a great deal of labor market impacts, and also from what Ragi was highlighting with employment rates. So there are going to be some real changes in income. And lastly, particularly, I'll be digging into changes in women's care work, because that really relates to some of the challenges we're seeing in women's employment decreasing. So just to provide a little context on the social protection response, there are a lot of details, and if there are any questions on these, I will try to answer them in the discussion. But to give an overview of the social protection response to COVID-19, there were a lot of existing programs pre-COVID-19. So there were social protection programs that actually existed already and acted as an important safety net. So existing cash transfer programs, whether in Tunisia, Panafin, Takaful and Karama in Egypt, for Syrian refugees in Jordan, UNHCR had been doing cash transfers. So there was the sort of assistance already in place. And that assistance, of course, helped protect people from the shock of COVID-19 to a certain extent. And also those existing schemes were often how countries expanded their assistance. So as part of a COVID-19 emergency response, countries often added beneficiaries or added payments through those programs. So for example, there were additional payments through the Ramed health insurance program in Morocco, or the expansion of the Takaful eligibility in Egypt. So that was one aspect of the response, was not only were there existing programs, but existing programs gave out additional payments or expanded their beneficiaries pool. There were also new emergency assistance programs, and the new programs focused on different groups across countries, trying to think about vulnerable groups or groups affected by the crisis. So particularly workers who might have lost employment. Exactly the nature of these varied across countries. So Morocco primarily gave payments to formal laid off workers, so workers who were in the social insurance system. Whereas in Egypt, there was a program specifically about payments to irregular informal workers. So somewhat different targeting of assistance in different countries. The payments and assistance in the emergency response also really varied in terms of their size and their duration. A lot of the payments were sort of targeted to that initial lockdown period, particularly in places like Tunisia. The payments were during the spring confinement period, April and May, and then stopped for the additional emergency response payments. And also payments were not necessarily really replacing wages. So the irregular workers program in Egypt was paying £500 per month, which is only a quarter of the median informal worker wage. So that program did go longer, but the payment size was smaller. So there's a lot of variation across countries in terms of not only who's targeted, but how long they receive assistance, the nature of the assistance in terms of how much assistance they're getting. So this is sort of the overview of the response. And there were important social protection programs in place and responses, but what we will see in this next figure is that we still had large losses in income. So this figure is looking at changes in income. We've got the categories of the February 2020, so where you were pre-pandemic, your income quartile, what quarter of the income distribution you were in pre-pandemic. And then we're looking at how much your income had changed as of February 2021. So a year later, how are you doing? And half of households, more or less, had experienced decreases in income from February 2020 pre-pandemic to then when we did wave 2, February 2021. And decreases were often large. Decreases of more than 25% were common, especially, for example, in Morocco. We see 45% of households reported a decrease in income of more than 25%. Income losses were worst for those who had the lowest income pre-pandemic. So those who were already vulnerable, particularly in Morocco and Egypt, right? You see a much stronger gradient in terms of income losses hitting those who were already poor pre-pandemic. Now, in the sort of better news department, about a third to a half of folks maintain the same income level. Some of that might have been the social protection assistance. And there were a few people who experienced increases in income. It was those who are already higher income. So basically what we see here is that sort of the net result of the pandemic a year on is that we've definitely had an increase in inequality, and very concerningly, poverty is going to be increasing here given the losses in income we're seeing, particularly at the lower income end in some countries. So although there was a social protection response, it was insufficient to ensure folks maintained the same kind of standard of living they had had. Now let's dig into that social protection and government assistance response. Here, this is showing who's receiving government assistance, the percentage of households by country, and where they were pre-pandemic in terms of income. Now, when I say assistance, assistance here could be those pre-existing programs, and actually most of the assistance, when we break it down, is pre-existing programs. So this is someone who is already receiving a cash transfer. And then there's some additional assistance folks got during the pandemic. So those emergency response programs. And what we see overall is a pretty sparse social safety net. Jordan has about 52% of people receiving assistance of some form, but outside of Jordan, you've got from 12% in Egypt up to 25% in Morocco, and that was back in November of 2020. It's actually gone down a bit over time in Morocco. So from 25% to 21% from November to February, and in Tunisia, 22% to 20%. So this is very much to the point that there was sometimes initial assistance, and maybe that's drawing back and not in place anymore. So even though incomes are still way down, folks aren't necessarily receiving any more assistance. Now, looking at the assistance by income quartile, right, that's on this graph, we do see that it's folks in the first or the poorest income part of the distribution who are receiving relatively more assistance, but it's not as well targeted as we would like to see. And we're not seeing really very universal assistance among the poorest. It's higher, but it's still only a third in most countries, or about 2/3 in Jordan. So we have a sparse safety net. It doesn't necessarily have very broad coverage and not necessarily reaching those who have the greatest need. Now this graph, I apologize, is a little small and hard to read, so I'll try to break it down for you. We're looking at that same outcome, receiving government assistance by labor market status in February 2020. So if you were a farmer, self-employed, and a regular wage worker, have you received assistance, right? Because some of these programs specifically targeted you were an irregular wage worker, you were an informal worker, and you need assistance now because maybe you've lost your job. And here we also see that government assistance is pretty poorly targeted in terms of labor market vulnerability. Dali had been talking about how there are different groups like farmers, the employers, and self-employed who really face a number of challenges. And farmers, except in Jordan, which is a very small sample there, were less likely to receive assistance than other groups, even though they're very vulnerable, so less likely than average. Employers and the self-employed had huge challenges, but only about average levels of assistance. Now, public sector workers who primarily had very little impact of the pandemic on their labor market outcomes, at least, were the least likely to receive assistance, so that shows some better targeting. But still 34% did in Jordan. And it was private formal workers that received more assistance. And this is especially true in Morocco in 2020, where we saw a lot of assistance targeted at those registered in the social insurance system when they might have gotten laid off. The exception here is in Egypt, where regular informal workers, so except in Egypt, regular informal workers in establishments were less likely to receive assistance, right? So informal workers were actually more vulnerable to negative impacts of the crisis, but they didn't necessarily receive much assistance, except in Egypt, where there was that irregular worker program. Tunisia in particular actually helped particularly informal workers who worked outside of establishments, but other countries, these outside of establishments, so like working on construction site workers, had below average assistance, even though this is a very vulnerable group as we've seen in past studies. And the irregular, another very vulnerable group, those sort of day labor workers, had similar or slightly higher than average assistance. So some of the targeting might have reached that group. But we're seeing overall not the kind of clear patterns of targeting the most vulnerable that we'd really like to see in terms of receiving assistance. Now, another challenge in terms of social protection is at the same time as needs went up, some social services actually disappeared, particularly school and nursery and childcare sort of retreated as things shut down. Schools were closed, nurseries were closed. And this led to a rise in care work. So here we're looking at women's hours spent caring for children the past week. They're comparing it to February 2020. So they're saying, did I work more or less? And we're looking at this across countries and by household composition or marital status here, kind of combining the two. Looking at the never married, married who have a young child under 6, married who have a young child that's school age. So we asked these women about their care work and comparisons over time. And we see pretty substantial increases in time spent caring for children compared to February 2020. So for example, in Jordan, 44% of women reported they were doing more care work than usual compared to pre-pandemic when they were surveyed in February 2021. And it's especially women with young school-age children. So for example, in Tunisia, those who are married and have a school-age kid, 46% of them reported more care work than usual. And it's likely, and we're gonna investigate further, that school and nursery closures are really driving this. It's making an additional amount of care work for families who have these children now at home rather than in school or at nursery. And it's really important to keep this whole second shift of care work in mind to interpret the results we saw Dr. Raghi present about women's employment patterns earlier. There really is a whole second shift of care work. So this is looking at the hours per day of direct, this is directly caring for children, and indirect, like cooking meals, cleaning things, care work. So the average over the week preceding the interview, average per day by household composition again and country. So this is showing that basically direct and indirect care work add up to very long shifts. And particularly for women with children under 6, they work the longest hours, 12 to 14 per day in care work. So that is not just a shift, but a shift and a half of care work. And we know from other research, it was very difficult to reconcile market work, right, working outside the home, and care work even pre-pandemic. And the pandemic and closures have really exacerbated this challenge. These are additional hours being added on top of already an entire second shift. So that is a real challenge to women's employment and pulling them out of the labor force as a result of these care work challenges as social services retreated. So I'll just end here with a few policy implications and try to tie a few presentations together as well. What we see here is that the social safety net, including pre-existing programs and emergency response, it provided some support, right? There was some support provided, but it was insufficient to prevent large income losses. And here we see the social safety net was not necessarily adequately targeted to the most vulnerable in terms of income levels, in terms of labor market statuses. And there are really concerning implications here for permanent income loss and the rise in poverty and vulnerability. So those are long-term concerning trends. Is there going to be a recovery, or is this going to be really a long-term change on trajectory? And as we saw in what was happening in the labor market, women face particular challenges in terms of exiting the labor force. And this may be related to their disproportionate and increased care work. And this is particularly concerning in a region that already has low and declining rates of women's employment pre-pandemic. The concern particularly is it's not clear the economic recovery, which hopefully is coming or starting, will reverse these losses. So it's really important to think going forward about monitoring and targeting policy action to those groups such as women, such as youth entering the labor market, who are facing particular challenges, as well as just supporting the well-being of those with income losses. We didn't talk a lot about coping strategies, but it's very concerning that coping strategies might mean eating less food, and that has long-term health consequences. So that's a real concern moving forward, as well as helping women to return to the workforce, policies that support that, particularly ensuring that the social services are in place to support that. So thank you all for listening, and I really look forward to the questions and discussion.
Thank you, Dr. Carolyn, for the presentation and actually for the rich analysis that have been done by the 3 PIs. And it's very interesting actually to have data over time for several countries to allow doing some comparative analysis. This is very interesting. And let me make 2 announcements before I give the floor to the audience for any questions. First announcement is regarding the firms level data. We have already the wave 1 firms level data for 4 countries, Morocco, Tunisia, Egypt, and Jordan. And the data will be released very soon on the data portal site, inshallah, within a week. This is the first announcement. The second one, actually, we have received Palestinian data on the impact of COVID-19 on the households. The survey was conducted by the Palestinian Statistics Bureau, and we'll try to harmonize the data and publish as well on the data portal. So we're gonna have more than 6 countries actually. More than 5 countries, yes. We're gonna have 6 countries that can be used in any research. Okay, right now we have several options, either by raising hands or having typing your questions in the Q&A. So please, if you have questions, raise your hands. And we're gonna have 2 rounds.
You have one raised hand. You have one raised hand by Valentine Mogaddam.
Okay, please ask your question.
Thank you very much. I'd like to begin by thanking the 3 speakers for their outstanding presentations. This is truly a service to us all. I'd like to just start with one question to Caroline, and then another one to Raghi. Caroline, I found it very odd that Jordan seems to have the highest rates of assistance of the 4 countries that you've been looking at. As I understand it, Jordan is an aid-dependent country, and I mean, why does it have more fiscal space to do that? It does seem somewhat anomalous. If you could please, respond to that. And then my question to Raghi has to do with, the comments that you made about employment and unemployment, between November 2020 and February 2021. In Tunisia, for example, there was some recovery of female employment, and their unemployment rates went down a little bit too. And I'm wondering if this has to do with household coping strategies, because there seem to be 2 parallel, somewhat contradictory developments going on. On the one hand, a lot of women being laid off or leaving the job market because of the heightened care responsibilities that Caroline also talked about. But on the other hand, there's some more increase in female employment. And I guess we're talking about 2 different cohorts, as it were. So who are the new ones who've been entering the labor force? And is this, an example of a household coping mechanism in the face of such a shock? Thank you again to everyone for fabulous research.
Thank you for your question. Let's have 2 more questions and then give the floor to the PIs to answer these questions. Dr. Heba Hamdousa.
Hello?
Yes.
Yeah, can you hear me?
Yes.
Yes. Dr. Heba, you need to unmute yourself.
Oh, sorry.
You're with us
I
now.
heard one of the speakers mention, or maybe even had it on the PowerPoint, that there may be some opportunities that are coming up in the labor market, and I'd very much like each one, if they have ideas about where are these opportunities that are coming up I think it was about turning informal to formal workers, but maybe there's also on the digital economy, what kind of lessons may even be positive? Thank you.
Thank you, Dr. Heba. We have one more question in the Q&A. by Shireen Abedi. Would you like to I'll read it. Could you kindly present or discuss the effect of the crisis on women? Dr. Raghi stated that many women became economically inactive. Do you have specific figures on Jordan? This is the question coming from Q&A. And, oh, okay. Please, please say it, Dr. Shireen. Okay.
Good afternoon, everyone. Yes, I joined a bit like 25 minutes late, so I wasn't sure that this was presented, but Dr. Raghi stated that many women who were employed before the crisis became economically inactive. And I believe that the slide did not include a gender-specific diagram. So I'm interested to find out if there is one, and what were the effects of the crisis on women's economic activity.
Thank you. May I ask those who are not asking right now to mute their mics? Next question by Dr. Mona, and then we'll give the floor to the PIs to answer the previous ones. Dr. Mona Saeed.
Okay, I just managed to unmute. Thank you. Lovely to be here and listen to everyone. Thank you for very informative and excellent presentations. It was concerning to see some evidence, especially in the last presentation, about rising poverty and inequality. And I was wondering do we have enough information to also look at distributional issues at the regional level? So can we see, for example, if in a country like Egypt, social assistance was concentrated in Cairo as opposed to other parts of the country, because this is very important to know for future policy advice and coping with the pandemic, and also whether there is a regional dimension to the impact, that the impact was more severe in remoter area in all the countries. Thank you.
Thank you, Dr. Mona. And right now we'll give the floor to the PIs to answer this question. And I believe we have time to have several actually rounds of the questions. So who will start answering the questions? Dr. Raghi, Dr. Carolyn, Dr. Marwani?
Let's keep the same order as the presentation.
Okay, Dr. Raghi.
All right. Thank you very much for these questions. Can you hear me fine? Yeah.
Dr. Raghi, you may want to put the camera off because you're breaking up a bit. So okay. Maybe for a better quality.
Yes.
Yeah.
Okay. Yes. Is that better? All right.
Yes.
So, Val, thank you very much for the question about kind of how women are responding to the crisis. I think what we're showing is that the degree of non-participation is being reduced somewhat in February compared to November, but I'm not sure I would say that I would interpret this as an added worker effect, that the response to the crisis is pulling women that would not have been in the workforce into the workforce. That would need a little bit more investigation. I actually, I'm going to share my screen. We did some gender disaggregated work on the transitions. So I'm looking at Tunisia specifically here, and we can look at, based on the status in February 2020, what was the status in October 2020. And if we look at women, you essentially have a lot of women who are in private wage work who actually pulled out. So they either became unemployed or out of the labor force. And that's a pretty, it's even a higher rate than in the case of men. Of course, those in public wage work did not leave at very high rates. Some of them, 5% after all of those who are in public wage work did go out of the labor force. That may be a care work sort of pressure that they had to remain home. Now, if they were employers and self-employed, they also left the labor force in larger numbers. The men who may have turned into private wage workers, whereas the women actually left the labor force. Now, fewer of the unemployed women in February 2020 were able to get jobs than men. And you can see that the men were kind of more successful in entering. So a lot of women who would have probably entered did not. So this is kind of the gender disaggregated transition data, and I think that answers the other question as well. We can do a lot more of that. We were worried about the female sample sizes among some of these categories, but I think they were decent in the case of Tunisia, and considerably more can be done along this dimension. Now, there were a few other questions. I think Heba's question about the good news, what sort of good news? I mean, I do think that there was experimentation with new forms of social assistance. And I would point out specifically the cash transfer program for informal workers that the Egyptian government started, and there were other examples of it, is really a novel way of acknowledging regular workers and acknowledging that they need assistance. And I think those kinds of social assistance can be extended post-crisis into a safety net or other increasing the safety net for these very vulnerable workers. So I think there is a silver lining there, and I'm sure my my co-authors will find others as well. And I'll stop here.
Thank you, Dr. Raghi, Dr. Marwani, Dr. Caroline. Dr. Marwani, would you like to add anything?
Yes, so
please go ahead.
On the question of Mona Saeed about the effects on women, one of the interesting results we found in another survey conducted on SMEs in Tunisia is that we asked them, for those who could not work and who would have been able to work from home but who didn't, what were the reasons? And most of us thought it would be childcare, and it wasn't childcare. It was there is no space in the home to work, while men managed to find more space. So in the same house, when there was work from home, men found more space than women. So this was one of the interesting. I remember I presented this at the 8th of March at UN Women, and there were lots of reactions. So here you could see. It's not just a matter of means, but it's just also power. I mean, there is place for the man, but not for the woman. On the opportunities, so the question of Dr. Hiba, yeah, there are at least these 2 points. So on digitalization, I think we've seen lots of efforts in the region. And in Tunisia, I remember in March when they gave the first cash transfer to the people, they gave it at the post, and so there were thousands of people together. It was really terrible mess. Pictures were horrible. And just a month after, they were able to give a card to everyone and to send the money by card. And people could go and use this card anytime and have the money easily, so without risk to be infected. So this showed that the capacities, and especially in a country like Tunisia, where there are thousands of engineers, etc. I mean, the capacities are there. So it's really a matter of incentives. And will the government have the incentive to invest in this or not? It did a lot in the pandemic period, but will it continue afterwards? Many people think that this could give a few % of GDP growth. So we don't know. It's not very clear because the political situation is not very clear, but a government going on a path of growth would clearly do it. Because it has this advantage of growth, but also, of course, of easily accessing people, less making them take risks, be together at the same place, etc. So the capacities are there. Will it be implemented or not? I don't know. It will depend. But I've heard yesterday, I was also in a World Bank meeting on a similar aspect, and I heard saying this in many other countries of the region, that the efforts were tremendous on the digital aspect. On the formal informal, it's more complex because in many countries of the region, we have from one side social protection, and we have social insurance. And I think the worker needs to see the advantage of being affiliated, because when you talk to many people who have access to social protection via the poor part, they don't necessarily would want to pay for social protection if they get it from the other side. So I think all these aspects need to be thought together. But many people see today the advantage of being within the systems. And so if they're able to see it in a clear way with a clear contract with the government, just pay very low amounts and you'll get health and you'll get pension. Probably it could be more vocal. So especially if, I don't know, a big part of the society, NGOs, MPs, others are involved in this thing, I think it could be more vocal today than in the past. And thank you.
Thank you, Dr. Marwani. Dr. Carolyn, the floor is yours.
Thank you. Yes, thank you everyone for the excellent questions. I'll start with the one on Jordan and assistance in Jordan. Jordan is very interesting in this regard. They have long had a pretty high level of assistance. I remember looking even at the 2013 Household Income and Expenditure Survey, and Jordanian households get a lot of income from other sources, not just from wage earnings, from assistance, from remittances and things like that. And that includes social assistance programs. The foreign aid goes both to refugees and vulnerable Jordanians. So that's one of the sort of frameworks of the response to the refugee influx, was to make sure that a lot of programs assisted the refugees, but also vulnerable Jordanians. So that's kind of built in to the social assistance program there. And another aspect is a lot of what people received was Jordan have reformed their subsidy system. They removed the gas subsidies, the fuel subsidies and the bread subsidies, and turned them into cash transfers. So that was a shift that led to more people receiving cash assistance rather than subsidized goods, that reform, which is part of why they're at a higher level. I think we kind of answered already Shireen's question on gender, and particularly that it was the private sector and women who were exiting. I don't have those numbers particularly for Jordan at my fingertips, but that's certainly something that could be analyzed with the data. In terms of one silver lining, I think one silver lining I'm hoping becomes more obvious is the importance of social services, including nurseries and schools and after school and all of those things for women's employment. I mean, the way we learned this was that a lot of women exited the labor force, but maybe it will help going forward put more investment and commitment to those important aspects. And while I'm interested in the digital economy, I'm also pretty concerned about the digital divide. For example, in Jordan, only something like 31% of households had internet. So that affects children's education, that affects all sorts of things. So even though you do see some shift to digital apps and new things, there's a real digital divide to worry about with that at the same time. And I know Mona had a question about the rise in poverty and inequality, and particularly looking at distributional aspects. And that's something you can do with the data. Remember, it's a selected sample, so it's distribution among those who own phones, right? So even when we're talking about the low end of the income distribution, this is a little bit of a selected sample in that sense. But we did collect information on urban rural, on governorate, or administrative first level per country. It's not necessarily representative at that level, but it was random digit dialing. So you certainly could do some exploratory analysis on that and see what you find, because I do think there are very different impacts. And for example, in Tunisia, usually it's the interior that's struggling and the coast that's doing well, but that a little bit flipped as tourism dried up, and really the challenges were very different for the two locations. So I think there's some interesting dynamics to explore there. Thanks for all the great questions.
Thank you, Dr. Caroline. Now we will open the floor again for another round of questions. Dr. Ibrahim has a question, and Dr. Nader Khabbani. Dr. Ibrahim, please.
Thank you. I have a question regarding whether the survey allows assessing the macro interventions, such as, for example, tax holidays or deferred payments or reduced interest rate and so on, because this would be interesting to know which of these are most effective, or all of them effective, which category tend to benefit more. The other thing also, I understand from Caroline's presentation that the support is not targeted to the most needy, especially with regard to agriculture. But how about some political economic considerations, in the sense that even if you look at the same types of jobs or businesses, the extent to which urban centers, especially the capital city, tend to be more favored, because it's important to actually address the concerns there much more than others. And finally, I have a question regarding the robustness and the quality of physical service delivery and online service delivery, and the extent to which it might have been a factor in the recovery of, say, like Morocco. I think Muhammad Ali Morwani mentioned that Morocco has done better relative to Tunisia and Egypt. Is it, or Tunisia? I don't remember. But anyway, so the question is along these lines, because I know from the experience of Dubai, for example, that digital connectivity and online service business, as well as physical service delivery, has really been very effective in terms of the recovery of the economy there. Thank you.
Thank you, Dr. Ibrahim. Dr. Nader Qabbani, the floor is yours.
Thank you. Can you hear me?
Yes,
we can.
Okay. Well, first of all, it's really great to see Marwani and Ragi and Caroline and everyone. So thank you so much to ERF for organizing this event. It's digital and virtual, but we really get a chance to interact, and I really appreciate it. And thanks very much to the team for this massive effort in terms of collecting the data. And I'm looking forward to playing with the data a little bit once we get a chance to. So if I understand Caroline's conclusions correctly, social safety nets in the region are already very weak and don't reach the most vulnerable populations. And they were essentially overloaded by the pandemic and responded, but really not in a way that completely not in a way that was needed. And I understand that there's coping strategies and mechanisms that the surveys have asked households about, and those will be coming later. So I guess I'm also interested in alternative sources of income, which Caroline touched upon briefly in her last response to questions. To what extent have other informal safety nets, community organizations, charities, extended families, remittances, were you able to collect any data on that? How did they respond? Were they able to cover the gaps? And given that this was a global pandemic, were they weakened as well? I'm doing some research in Somalia and Syria, and talking to policymakers in Somalia and financial institutions there, they suggested that there was quite a decline in remittances coming into the country, but that internal safety nets kind of kicked up a little bit. Syria, possibly same thing. I don't know about the remittances part, but talking to NGOs there, they suggest that there's a massive community effort to try to reach the most vulnerable. So I don't know if your data has any, have you managed to collect any data or had a chance to look at it, but what's your sense of these alternative forms of social support? Thank you.
Thank you, Dr. Nader. And I believe we don't have any other raised hands. So please, Dr. Ragi, will you please answer?
Sure. And I think, thank you for all these questions.
Dr. Ragi?
Yes, I'm unmuting. Can you hear me? Hello?
Yes.
Yes, we can.
Sorry. So I Ibrahim and Dr. Nader for these great questions. And my answer is that for most of these is that, yes, we provide data, but we don't answer. And this is what we designed to do with this session, is to whet your appetite whet your appetite, to get your juices flowing, to go and use the data and answer these questions. And the data is, some of it, a lot of it is publicly available already. Some more of it, the firm's data, which we haven't even started analyzing yet, is going to be available to everyone. At the same time, it's available to us. And our next policy brief is going to focus directly on the firm's data, which will hopefully answer some of the firms that Dr. Ibrahim raises, some of the questions that Dr. Ibrahim raises with regard to the support efforts to businesses, and whether businesses were able to make use of those or not, as well as some of the questions. I think which firms were able to use technology more in their business model. So the firm data set has not yet been looked at or analyzed. We have no outputs from it yet. And it's really a chance for everybody to start jumping on them and creating these answers at the same time that we create our highlights and our policy briefs. But we are very happy that we have whetted your appetite. And I will let Carolyn address Nader's question. So I will stop.
So on
Dr. Marwani?
Yeah. On the macro interventions, probably it would be difficult to have something on the really macro, like the interest rates ones, but maybe more on, as Raghi said, on some business interventions. If they were focused on some periods, probably we would be able, if something started in October or in November, using the panel of periods and countries. If it didn't happen in all the countries, we will maybe able to do something of kind of difference in difference or something of this style. So it's possible if we have enough points, because the firm survey we have less than the household surveys, but on the firms we can do these kind of things because we have a lot of performance variables, so we can see on these variables what is the impact. Yeah, on political economy, of course, you're right. I mean, people think about what happens in the cities much more than what happens in the countryside. So it's clearly the reason, but also maybe sometimes the analysis is not right, because people, and Carolyn said it very clearly, people tend to think, for example, in Tunisia, that is the remote regions, that is the poorest people that suffer the most. And in this crisis, it's probably not the poorest that suffer the most. It's the category that is just above the poorest, because they don't have for example, in Tunisia, there is the PNAFN for the poorest, and those who don't have the PNAFN, who are informal, and so who didn't get any transfer, the situation is certainly much worse during the crisis than those who get the PNAFN. So the first reaction of the government was, okay, we have 180,000 families that we know very well, we will give them a little bit more and try to find other poor. So these ones had the chance of being known, and the ones who are not known probably had the worst situation, including for the woman part, many maids. So many maids, especially the foreign ones. And in Tunisia, for example, it's becoming very important. Most of them didn't have any kind of formal help, not from the government, from anything. On physical service, I don't have any information, so I'll let Carolyn maybe know about it. And on migrants, I think it would be interesting to look at what's happening for the different countries. Because in Tunisia, for example, most of the migrants are in France or Italy. And what happened in these countries is that I've heard recently that in France, the savings of household increased by 200 billion euros. So the government gave money, I mean, thousands of, not to everyone, but to many people. And it's very different situation than our countries where people didn't have money. So probably, at least on average, remittances, if our population is in the average, if they're not poorer than the average, and so maybe have less means than the average European or American, the help was big. So probably the remittances were able to increase in this period. I would expect it for countries like France, but of course we have to check this. And we have to check what's the origin of the people. If they lost their jobs, of course, it's not the category that has saved. So it's a complex phenomenon. But although the crisis is everywhere, people in rich countries where there is where the government spent huge amounts of money may have made a difference. And thank you.
Thank you, Dr. Marwani. Dr. Caroline?
Sure, thank you for these very interesting and important questions. I'm a little ahead of the curve with this because I was just cleaning the firm's data. So I am probably the only one who has looked at the firm's data before it has been released. And one of the great things about the firm's data, to Dr. Ibrahim's question about macro interventions, is it has questions on whether you applied for different types of assistance and received them, or what you think the most needed policy is, as well as why you maybe didn't apply. So there's some really important data analysis to be done, really digging into that and looking at which sectors really need which policies. And indeed, there are things about tax holidays, social insurance, in payment holidays, like the need to defer paying into social insurance, subsidized inputs. So there's a real variety of different policies that different sectors are talking about that are going to be very important for that enterprise recovery and the longer term macro picture. And I very much also agree with the point that there's a major political economy component to what's going on in terms of not really thinking about farmers or the support for farmers or anything like that. Because a lot of the policy response really focused on replacing wages. And only some people have wage earnings, and particularly the sort of necessity self-employed entrepreneurs and farmers aren't going to have wage earnings. So there's not any kind of social protection response targeting them in terms of at least emergency assistance. These may be groups that were receiving the longer term social assistance programs based on proxy means tests for those programs. But I think that's an important gap in the safety net that really needs to be addressed going forward. And the firm's data also do have some information about how firms may have adjusted their models. So I was looking at the other responses, and there was everything from QR codes to like using an online app for delivery. So there is some of that firm response data as well. To Dr. Nader's question, I think it's a really great point that I was talking about the social safety net as this government social protection system, but in fact, the safety net that had the broadest reach was the social network safety net, right? Not the government response one, but indeed people relied primarily on their friends in the country, their family in the country. So when we look at those coping mechanism responses, it was really common responses included family in the country helped out. Sometimes family abroad, if they had family abroad as well, selling assets, spending down savings. There was those who had savings spent them down to deal with the effects of the pandemic. So it was the informal safety net that took a lot of the brunt of the pandemic, given the major gaps in the formal safety net. And so that includes some alternative sources of income like remittances and also different strategies. Like we didn't really explore this in detail in the presentations, but some people maybe who were laid off turned to self-employment activities, maybe earning less, but engaging in a different type of income or joining a family business, even though those might have been struggling too. So definitely alternative sources of income and social networks, the informal kind of safety net played a huge role in the pandemic response as well. So hopefully those answered all the questions, but let me know if there are others. Oh, I see Mona had one last one.
Yeah.
Minimum wage regulations. Yes. I don't know of any relaxation. The Jordanian minimum wage actually, I think, went up during the pandemic, if I recall the timing of that correctly. And in Egypt, the minimum wage went up. This again is to the point that a lot of the responses on the wage end, and the minimum wage is only effective within the formal covered sector. So I think that's a bit of an issue in terms of formality dynamics too. As the minimum wages go up in a difficult economic time, it may disincentivize formality.
Actually, in Egypt, the minimum wage is only for public sector workers. So even narrower than the formal covered workers.
In Tunisia, in general, it's respected for men, even in the informal and ag sectors. People even get higher than the minimum wage, but for women, not. So, for example, for women workers in the ag sector, they get less than the men and less than the minimum wage.
Okay, thank you. Thank you again for answering the questions. Do we have any other questions? I can't see any raised hands. Any other questions? Okay. That's great, actually. Let me first thank our audience for making the time and the effort to be here today and for their valuable questions and for their attending. And I would like to thank our speakers actually twice for their great presentations and for being the PIs in this project and their effort during the last year and the current year in all the steps of the project. I would like to thank again the sponsors who made this possible, and by their funding, actually, they made it possible to provide the researchers in the MENA region with the most recent data on the impact of the COVID-19 on both actually households and firms. And I would like actually to thank as well each member of the ERF team who made this possible and for their efforts during the project. And we're still, actually the project is going on till now. And let me encourage you again to visit the website where you're gonna find the previous policy brief and the highlights for wave 1, and you're gonna find in the data portal wave 1 and wave 2 data sets. You're gonna find very soon the wave 1 for firms, for the firms data. And in addition, you're gonna find other data sets that are related to different countries in the MENA region. As I mentioned before, the hikes, the labor force, the sample surveys, and the labor force panel surveys. Okay, thank you again, everyone, and thank you for being here. Thank you.
Fantastic job, everybody. Fantastic, really impressive. We're very grateful for the great work. Yes, please do stay tuned in to all the releases of the data sets, of the publications coming up. And what remains is to thank Dr. May Gadalla for an excellent job facilitating that session. And I see on the side there's been conversations inviting you all to the upcoming sessions. For next week, we will be having our third plenary session on political economy challenges to diversification strategies. And following that session, there's going to be a set of parallel sessions, or what we used to call in times of actually real conference time, is a number of parallel sessions that you may want to stay tuned in for. So please do check the conference agenda, which is accessible online. The next plenary is going to be followed by an impressive set of parallel sessions. And then during the course of June, we're going to also be having another 2 special panels that are close to ERF's work and heart. So please do stay tuned in, and a warm thanks to each and every person for making this happen so gracefully. Thank you.
Thank you very much.
Thank you all.
Thank you.
Thank you.
Thanks, everyone.
Thank you. Have a good evening. Bye-bye.
Bye. Bye, everyone.
You too.